Hi everyone, we would like to start by acknowledging the traditional custodians of the land in which we're meeting, the Wurundjeri people of the Kulin Nation, and pay our respects to elders past and present and extend that respect to all Aboriginal and Torres Strait Islander people today. So with our coffee catch up today, we've got Ashwini Chapekar, who's actually one of our paediatric dentists, and she's going to talk about the importance of actual oral health care for children. So Ashwini, thank you for coming along. It's lovely to see you. Can you start by telling us, what do you see? You see a lot of children. What are the big issues that you're seeing with children, and what are we doing to address some of those issues?
So the predominant issues that we see with children, which we are all here for, is mainly dental caries. So that's the most common issue that we would see. And we do know that there is, by percentage if we go, I think it's about at least 30 to 40% of kids between the age group of approximately 0 to 5 who would at least have one tooth that has decay or caries in it. Wow. And it's even higher when you go to 5 years and older, and that's even more of a concern, because that's the time when they, about the age of 6.5, they would start getting their adult teeth, and that becomes more of a concern from a dentist perspective, of course. And I think the major reasons why we see these things is revolving mainly around the oral health education. Now it's easy to say, for a child, go brush your teeth twice a day. But I think it all starts from home. So it's more of parent oral health education, including a family oral health education as well, because as I said, it all starts in the family. So it's easy for me to say every 6 months, your child is not brushing twice a day. But then it's going to die down. So unless and until the family is more oriented towards health education and their own oral health, it doesn't go down very well with the child. We do see some other kids where sometimes the oral health is sort of difficult, because if you have behavioral concerns or you have developmental difficulties, then we understand it is a bit difficult to get the oral hygiene right. But I think predominantly where the issue starts off again with the oral health education, with the diet that kids have nowadays. It's more processed, it's more sugary, it's the hidden stuff that you don't know what's most of the parents come and say, but we have the organic one, but there's no
sugar in organic.
It's all hidden sugar, isn't it? So and typical things like Diet Coke, but it's Diet Coke, but it's still acidic. So that's the sort of thing we see. Then it's with the oral hygiene. Most parents don't know that the kids' teeth should be brushed as soon as they come through, which is at 6 to 7 months. So these are a few things that we do see a lot. Then it's the habits with younger children, feeding habits, nursing habits, like putting the child to bed with a bottle in his mouth, his or her mouth. You have not just the milk in the bottle, sometimes there is juice in the bottle, and to a large extent I have seen iced tea in the bottle for some reason. So there are various ideas that some families have.
What are the impacts of that for children? So if children have poor oral health, what happens?
Most commonly pain. The child is in constant pain, chronic pain actually, and sleepless nights, including the child is for the parent as well. Missing school. So kids tend to get behaviorally quite aggressive because they're in so much of constant pain. Missing school, missing socializing becomes difficult, because say a child at 6 years of age or 4 years of age having black front teeth sometimes get bullied at school. So it's a lot of social aspect as well. And then, of course, there are studies which have shown that kids who are in chronic pain and inflammation, overall, their health is not great. So it affects a lot, because if the child is in constant pain, he's not going to eat food, and he's going to be malnourished. He's going to keep losing weight, and so on and so forth. It's like a chronic cycle that unfortunately they get into.
Gosh, it just makes it so much more important, the work that we do, doesn't it?
It absolutely does.
How do you think, you talked about the family unit is a really important part of the solution to this problem. How do we go about empowering families to actually pick this mantle up that we all know is really important? How do we empower families to do that?
So I think, again, it starts from the basics with pregnant mothers, maybe. And especially first-time mums who are actually not aware the do's and don'ts. Maternal child health nurses are great. in that aspect. And if we can actually encourage them or educate them, I think we do have the oral health promotion where we do go out and have lectures and discussions with the maternal child health nurses. And the response has been really great with them. There are new things that they learn from us and they didn't know about it. So if that can be extended and that goes to every family then rather than just a specific group or a specific area, that will be a good start. Also, we have Smile Squad, which go out to schools, which is a good start as well. And then it could go out obviously to the families. If we can involve kinders or early education centers, and that could stress more on the importance of early education, and that education starts with the parent again, including the grandparents sometimes, because grandparents take care. Now everybody who's going back to work, grandparents are in charge of the children as well. So I think it's more of the education of the parent from that perspective.
So it's kind of like that old adage that it takes a village to raise a child.
Absolutely.
So we need the whole village involved in this process.
Yes, absolutely. Yeah.
Fantastic. So can you talk me through how your team is working towards improving the paediatric care that we provide? So what's the ongoing, I guess, improvement cycle that you guys are on?
So somewhere last year, I think we started with a caries assessment clinic. So it is a more pediatric caries assessment clinic, because we're all aware that COVID didn't help. The lockdowns and the pandemic didn't help a lot. So we had a lot of patients that we wanted to see, but we couldn't see at that point of time. So with the caries assessment clinic, what then happens is they don't have to wait for that waiting list. And they, even if they come in as an emergency, they get assessed, they get booked into the caries assessment clinic, and there is one of the pediatric dentists, one of us, who is supervising the therapist and the general dentist into the caries assessment clinic, and the child gets a comprehensive assessment and a comprehensive treatment plan, whether it could be treatment with nitrous oxide sedation, and then the child gets booked into with the pediatric dentist. Otherwise, it's a general anesthetic, but then it's a comprehensive care. It's not just that emergency care that we want to provide. We want to see to it that we treat the child as a whole. And then with that caries assessment clinic, we also have the therapist talking about the oral hygiene.
Oh, fantastic.
We have Cert 4 DAs in our primary care department who do a lot of great work on the education of the entire family as such.
So what are you excited about in the next 12 months? What do you think the department's going to do? And, what's bringing you to work every day?
Oh, but the team is great. Love the team, love my colleagues. Personally, love the colleagues that I work with. Love the multidisciplinary approach that we have in treating every child. It's not that we are left, it's the pediatric department, you just do it what you want to do. But we have a beautiful, supportive, every other specialty is lovely and supportive, including the management who wants us or to do more. And as I always say that there's always room for improvement. So otherwise we wouldn't be where we are in the first place. In the next 12 months, what we are looking at doing is actually seeing as many kids as possible, getting them off the wait list, which we have a very long wait list at the moment. But we are, and one of that approach was a caries assessment clinic. So we are trying to add, we had OHT, the oral health therapist initially, but now we are adding on general dentists as well into it. So that is pretty exciting because they see a very different perspective. There are so many things that we can do. And I think that should be something, now that we are out of the pandemic, I think we can concentrate and try and improvise and involve as much of healthcare facilities and healthcare workers that we can, because it's a team effort. It's not a one-man job.
Let's get the mouth back in the body, hey?
Absolutely.
Ashwini, thank you so much for your time. It was so great to talk to you. Thanks for the coffee catch-up.
Thank you for having me.
Continue the great work in your paediatric department. It's fantastic, so thank you.
Thank you very much for that, Sue.